Hey, this is Matt Line, and this is Making Central Lines Safer. So why are we doing a course on central lines? Well, first off, central line is a dangerous procedure. Placing central lines is a dangerous procedure. So defining it as a surgical procedure has a lot of advantages for us to make it safer. First off is because it is a surgical procedure, there's going to be a standard way of doing this procedure. So we have standardized how we place central lines in our institution so that we can have a standardized training and competency assessment for you so that you have better outcomes when it comes to central line. We have been doing this program for the last nearly 8 years, and we've had a decrease in complications, which has been nothing short of dramatic here in our hospital and has led to less costly delivery of care. These complications from central line are in two broad categories. The first is mechanical complications, and the second is infectious complications. For mechanical complications, before this program we had about 4 major arterial cannulations by resident learners, and after this program we've essentially had 0. This has saved us a substantial amount of money in training residents, as well as improved the mortality rate in our health system. But bloodstream infections are actually a larger problem than mechanical complications. Central line associated bloodstream infections, or collapses, are fairly costly. An infection associated with a central line costs the health system about $68,000 each occurrence and has a mortality rate of between 12 and 25%. It's also a nationally reported quality measure. Prior to this program, we had approximately 3.75 infections by resident insertion of central lines per quarter, and after this program, we've had none for the last several years. When you're talking about collapses, it's divided arbitrarily as an insertion-related infection and a maintenance-related infection. This arbitrary definition means that if an infection occurs within 7 days of insertion, it's blamed on the asepsis portion of the insertion. After 7 days, it's blamed on how well the maintenance of the line is. However, our belief is that everything is related to insertion. The better you place your central line, the easier it is for a nurse to take care of it, the less collapses we have, and we have plenty of data to support that. So what we're going to do in this training is break it into 4 components. The first is the aseptic portion, and how do you make sure that you're placing lines in the most bacteria-free manner you can. Second is the ultrasound and how to use that to avoid mechanical complications. And the third is where is the best place for you to place a central line and what are the common errors and how to avoid them. And the last is placing the appropriate dressing.